Hello, I'm Joan Justice with HealthWorks Collective, and I'm here with Blair Palmer and Maeghan Orton, both from MedicMobile. And Blair is Director of Special Projects, and she has a background in global health, infectious disease, and medical technology. And at MedicMobile, she seeks to improve access to healthcare worldwide. Blair, tell us a little bit about MedicMobile and the projects you've been working on. How did it get started, for instance, and what's the mission?
Sure. Well, Josh Nesbitt, who's our CEO, started MedicMobile essentially out of a backpack. He went to Malawi on a personal mission with 100 phones and was working in a small hospital there called St. Gabriel's, and figured out while there that the use of mobile technology could help improve upon their system, specifically from an emergency response setting. And in essence, MedicMobile was born. We spun out of a larger organization called Frontline SMS. And as projects and the work expanded, we became our own entity, which is now called MedicMobile. So our mission, we're a mission-driven organization, and our mission is to improve healthcare of the underserved by using mobile technology worldwide.
Okay, and you develop your own software and you use existing software, is that correct?
We do. We have our own team of in-house developers that has developed our own software platform called Kujua, which means to know in Swahili, as well as we develop parallel SIM applications. But we also believe that everything that we develop should be open source, so we want to share that with the community, as well as leverage other mobile health tools if they're more appropriate in settings where we work. So we look for partnerships and collaborations all the time, and in fact, those actually help us really do the work that we do. So we welcome all of that and hope that our innovations contribute to others as well. And we don't want to reinvent the wheel if somebody's doing something in a very effective and cost-effective way, in a way that can show the greatest impact, because that's really our goal.
Okay, and so the way it starts is you partner with organizations such as ministries of health or non-for-profits, and then you embark on a project together. Is that usually how it works?
It depends. We do have a project checklist. We get a lot of people that come to us and saying, we have this problem and we would like you all to create a solution. What we try to do is then work with different organizations, whether it be an NGO, whether it be a government, whether it be a company, etc., to then build out what the most appropriate tool is. And that could, all of our projects are shaped in so many different ways, so it's hard to say that we have sort of a cookie cutter recipe or formula for how we work. But for the most part, everything is built on partnerships. And then we build together, using our current tools or existing open source tools, the best solution for the projects worldwide. And we try lots of different things. We like to be innovative. We're scrappy as well. So we look to say, okay, let's see if we can try something on a smaller scale first before we go really large scale, to make sure that it's sustainable, will work, and then we look to scale it on a larger level with, governments, et cetera, or whoever wants to then take the project forward. We always try to put ourselves out of a job. That's kind of our goal.
Well, that's wonderful, though, because then the job goes to the local people. I mean, that's where it belongs.
Exactly. We want it to stay in the communities where we're actually implementing the tool. And as I mentioned earlier, too, our goal is really to have the greatest impact on our patients' and users' lives. So that's where we sit. So if the project can have the greatest impact, and which is generally leaving it within the community, then that's where we'd like it to stay.
Maeghan Orton is talking to us from Kenya, and she's working on several projects for MedicMobile. And Maeghan, why don't you tell us briefly about the projects you're working on, and maybe some anecdotes about a specific project?
Great, yeah, no problem. So the project that we're currently in the expansion phase for is based in coastal Kenya, in a small town called Kilifi, and the project focuses on antenatal care reminders for mothers, immunization reminders for children, and then malnutrition monitoring and emergency transfers. It's a fairly unique program in that we work through community health workers at the invitation of the Ministry of Health. and basically provide them with reinforcement training around good practices in antenatal care and immunization care for children and mothers.
Mm-hmm.
But then also we provide them with really basic mobile phones and about a week's worth of training as to how to schedule and register patients for enrollment in care at local clinics.
Okay.
And yep.
I was just going to ask if you did the training yourself there in Kenya.
I've been part of the trainings. Right now, our local Kenyan staff are actually managing the trainings, but we share the training actually with the Ministry of Health. So Medic's model is that we don't actually run any clinics or distribute any medications. We work by invitation only with partners that just request our support and our expertise in terms of health systems design and delivery.
Okay, great. So you're working with the local community and the community health workers?
Yeah, so we have a small office out of Nairobi, out of a place called the iHub, and then this is one of our satellite offices.
Okay, great. So that's one project, and you said you were working on 5. Tell us about another one.
Another project that's actually quite interesting is one that we're implementing in partnership with a group called Next Sleep Analytics. And what it is it's a cold chain monitoring program that uses the headphone jack of a mobile phone to receive temperature readings, and then SMS notifications are sent out to clinical staff to let them know when the temperatures within the vaccine cold storage unit had gone outside of a safe range.
Really? Okay.
We just wrapped up, yeah, it's really, really cool. We just wrapped up a 4-week pilot, and the results were absolutely astonishing. It was during a local strike for the nurses, and so the clinics were actually empty. But the nurses continued to receive the notifications via SMS, and we estimate that 5 separate fridges in different clinics were saved. And when you quantify that out, that's absolutely thousands of dollars worth of vaccines. But what's more, it's actually improving the stability of the entire vaccine monitoring system.
Yeah.
And what's most exciting about this project is actually after the project wrapped up, we went to each of the clinics individually and said, we'll leave the devices with you, but only if you maintain the cost of the data and SMS. And the ministry has decided to take on this program entirely on their own. So they, as the clinics, will actually be providing all of the funding to maintain the devices over time. And we've left every single one of the devices in the clinics.
See, that's wonderful. And that was one of my questions, what's the future of this program, of these programs? Because so many times they kind of fall apart. You do a pilot and then that's it and it's over. But if the local government takes it on, that shows that it really has some use. And if they can financially support it themselves, I mean, that's just great. That's great. So how long have you been there?
It's brilliant. I've been here for 7 months now, but I've lived and worked in Africa for just over 3 years. I've worked in around 14 countries around the world on 4 continents.
Wow. I'm jealous.
Yeah, I have some pretty sweet holidays.
That's wonderful. Well, it was so great talking to you, Maeghan. I really appreciate your being in on this call. And I'll let you go now because I know that you're running out of power. Thank you so much.
Maeghan, thank you.
Great. Have a nice day, ladies. Thank you.